In this video, we look at some practical steps that dairy farmers can take to reduce the risk of antibiotic-resistant bacteria developing on their farms. Firstly, before reaching for the antibiotic, always ask yourself, is it really necessary in this instance? Of course, sick cows need treating, but antibiotic is not always the best treatment. For example, the lame cow with a sole bruise or sole ulcer needs her foot attending to, a block, and an anti-inflammatory injection, but not antibiotic. In particular, avoid the unnecessary use of the critically important antibiotics. Your vet can explain to you which these are. These antibiotics are the last line of defence against some important infections affecting humans, so we must guard them preciously. Number 2. If antibiotic treatment is required, always use the correct type of antibiotic and at the correct dose rate. You must follow veterinary advice as to which antibiotic to use and know the weight of your patient to avoid underdosing. Overuse, underdosing, and not completing the correct course of antibiotic are all risks for resistance to develop. Number 3. Avoid mass medication of antibiotics to healthy animals. This practice is called prophylaxis. It is not commonly done on dairy farms, except when we use blanket dry cow antibiotic therapy. Selective dry cow therapy is where an internal teat sealant is always used, but antibiotic tubes are reserved for use in only those selected individuals which need them. This practice alone has the potential to dramatically reduce the unnecessary use of antibiotics in dairy herds. Blanket use of antibiotics for calves is another potential example of prophylaxis. In short, it is poor practice. Number 4. Avoid other unnecessary exposure to antibiotics for animals not requiring treatment. On dairy farms, the most common time when this occurs is when withdrawal milk containing antibiotic residue is fed to calves. This is a known risk for promoting antibiotic resistance. Dump your waste milk and do not feed it to either dairy or beef calves. Finally, number 5. We only need antibiotics when we have bacterial diseases. Keeping a healthy herd reduces the need for antibiotics. For example, if your main use of antibiotics are for mastitis treatment, work with your vet to reduce your mastitis rate. We all want healthy herds, but they don't happen by accident. Use vaccination and other disease control measures, practice good biosecurity and good hygiene, develop and implement herd health protocols with your vet for a healthy herd. The principles of responsible antibiotic use can be summarised by the 3 R's. Replace antibiotic where possible. Reduce the need for antibiotics by keeping your herd healthy. In other words, prevention rather than cure. And, where antibiotic is required, refine the way you use it to lower the risk of selecting for resistant bacteria. Replace, reduce, refine.